All right, we're going to wait just a minute to let everybody get settled in, and then we'll go ahead and get started. All right, so I think we're going to go ahead and get started. I'm Jessie Burke. I want to welcome you all here to the final seminar for our Pitt Public Health Conversations about COVID-19 series. I've really enjoyed moderating these sessions over the past 2 months. And because of the remote format, I often feel like I'm a radio talk show host, broadcasting to a wide and unseen audience. My role in this capacity is particularly notable because my first journalism class back in high school was where I first really and truly paid attention to the Salk legacy in public health. And bear with me for a minute while I tell a quick story and connect all the dots. So as many of you know, the previous dean of Pitt Public Health, Don Burke, is my father. So I grew up hearing about infectious disease research and prevention my whole life. And when I was in 9th grade and trying to tackle my final assignment for my journalism class to interview and write an article about an influential person, it was my dad who offered to introduce me to Jonas Salk. He knew Dr. Salk from his work and considered him both a public health and personal hero. Dr. Salk graciously agreed to the phone interview, and my appreciation for his critical role in protecting population health grew, and I started to better understand my dad's calling. So close to 35 years later, I'm now a professor of public health in the Department of Behavioral and Community Health Sciences here at Pitt Public Health, and I have the honor of introducing Jonas Salk's son, Peter, as a guest speaker for this seminar series. From the very first time I met Peter, I felt an instant connection, and I'm thrilled that he's our first speaker for the seminar today. So Dr. Peter Salk has served as president of the Jonas Salk Legacy Foundation in La Jolla since 2009, and is a part-time visiting professor here at Pitt Public Health in our Department of Infectious Disease and Microbiology. He graduated from Harvard University and from Johns Hopkins University School of Medicine, and undertook 2 years of house staff training in internal medicine at the University Hospitals of Cleveland. He then worked in his father's laboratory at the Salk Institute for Biological Studies from 1972 to 84, conducting research on biology and immunotherapy and cancer and autoimmune disease, and strategies for vaccine production. He worked again with his father from 1991 to 1995 on a project to develop a vaccine for HIV infection, and subsequently engaged with the introduction of AIDS treatment programs in Africa and Asia. His current activities include educating the public regarding his father's work and life, and exploring approaches to reducing the severity of public health problems and to improving prospects for smoothing the transition to a sustainable human future. Thank you, Dr. Salk, for joining us here today. I'm also really excited about our second speaker, who is a distinguished alum of our school. So again, a little bit of background. So my namesake, my great-grandmother, Jessie Vickerman, was an elementary school teacher. My grandfather was a high school math teacher. My mom was an English as a second language teacher for a very long time. So it's really not all that surprising that I've ended up serving as Associate Dean for Education here at Pitt Public Health. I'm thrilled that we have an alum of our program here to speak today. Dr. Mehran Massoudi did his training and graduated before my time at Pitt Public Health, but talking with him and learning about his contributions to the field of public health has truly bolstered my commitment to training the next generation of public health professionals. Dr. Massoudi was appointed as Regional Health Administrator for the Office of the Assistant Secretary of Health, the U.S. Department of Health and Human Services for Region 6 in October of 2016. He is a commission's corps officer in the U.S. Public Health Service, having served since 1984, and he holds the rank of captain. He's the senior federal health official representing the Office of the Assistant Secretary for Health and the Office of the Surgeon General in Region 6, which covers Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. Region 6 is the third most populated among the 10 HHS regions, having a large ethnic and racially diverse population, and the second largest Hispanic population in the country, covering 2/3 of the US-Mexico border. So prior to that work, he served as the Director of Prevention Research Centers at the Centers for Disease Control and Prevention. Beyond his regularly assigned duties at CDC, Captain Massoudi also completed 5 international deployments for CDC and the World Health Organization as part of the polio eradication initiative. He's also traveled to Haiti as part of the department's health and medical response, and most recently was deployed as lead for the EPI team in Liberia for the Ebola response. Captain Massoudi's PhD and MPH in epidemiology are both from Pitt Public Health. So I hope it's clear that the future of public health is really important to me in so many ways. And I'm really thrilled to be a part of this seminar focused on the impact of COVID-19 on the field and our future. I'll now turn it over to Dr. Salk, who will begin the conversation. After he and Dr. Massoudi present, we'll open it up for questions from the audience. For that portion, we'll use the Q&A function. You can ask your questions and I'll help to moderate. And please note that we're recording this session. So with that, Dr. Salk.
Oops. Okay, Jesse, thank you so much. And that was a very moving story about your interactions with my father. I really am glad that you shared that. I'm going to go through a little bit of a sweep of things, starting with the work that my father did on the polio vaccine at the University of Pittsburgh, which began in 1948 and essentially was completed in 1955. Polio was a terrifying disease of the last century, with actually worldwide around 600,000 cases a year, and children being affected, paralyzed, handicapped, on crutches, and scenes such as the following, where there are children in iron lungs.
So Peter, I'm sorry, but we can't see your slides. I think if you just want to share them quickly. I know you have some great photos.
I'm so glad that you reminded me of that minor detail. Let's see if this works. Is this working now?
I am not seeing it.
Okay, I clicked on share screen. Oh, so now what I have to do is click on this. Thank you. So sorry for the glitch.
That's all right.
Oh, now I have to click on share. All right.
We're almost there. I think it's coming up. Let's wait and just, there we go. So we can now see the photos. Wonderful, thank you.
Okay, I apologize. All right, so polio, terrifying illness of the last century, epidemics coming each summer, parents terrified, keeping their children protected, not knowing when an epidemic was going to strike. This was a disease that was on the public's mind for many, many years, and desperately wanted, the people desperately wanted something to be able to protect them from this terrifying onslaught. So, which included these kinds of scenes of patients in iron lungs, some of whom may never have left those iron lungs. This was just a very frightening undertaking. The work with the polio vaccine started at the University of Pittsburgh. This was a municipal hospital, which is now Salk Hall. On the left, in the basement, the first and the second floors, is where my father and his research team did their work. On the right, it was the first home of the Graduate School of Public Health. This was my father and his research team. Just keep going. Work started in animals. Work continued with some preliminary experiments in human children, starting in 1952. Trials with the experimental vaccine, they were expanded in Pittsburgh, starting in early 1954, leading to a massive national field trial encompassing 1.8 million children, This was something unprecedented and has not been matched in terms of its experimental scope. April 12th of 1955, 65 years ago, this past April, Dr. Thomas Francis was in charge of evaluating the results of the field trial, and he made the announcement, which my father didn't know he didn't know what the results were going to be until that morning at breakfast, that the vaccine was indeed found to be safe, effective, and potent. That announcement was met with jubilation. These are reporters at the bottom scrambling to get their copy of the handout of the proceedings that just were about to take place. And the public was just so enormously moved by what had happened, and this was their victory. This was not just the work of one person or a research team. All of the people that worked in the laboratory and volunteered for helping out in the field trials, the people of Pittsburgh who supported these efforts, the people of the country who funded the efforts through the March of Dimes with their dimes, their dollars. This was the people's victory. When the vaccine was introduced in 1955, this is the cases of polio. Very quickly, within 7 years, the incidence of new cases of polio in the United States have been reduced by 97%. Okay, we are now faced with another terrifying situation. Some people foresaw it. Most of us were caught by surprise. And it's been an extraordinary period of orientation, reorientation, finding where do we stand in the face of the threat that has been presented to us. Fortunately, we have developed enough of an armamentarium of public health measures to introduce anti-contagion policies to help stop or blunt the spread of the epidemic. This is a preliminary publication, an accelerated article preview of a paper that's due to come out in Nature from a group in Berkeley, showing the effect of these policies on the pandemic in 6 different countries. What I'm going to show you in 6 different cases is at the left, the map will show the actual cases observed at the end of the period of observation in that country. And on the right, what would have been projected, what was projected would have taken place by the same date if there had been no effective policy interventions enacted. So here we'll start with China. This is data through the beginning of March, about 74,000 cumulative cases at that point. On the right, had nothing been done in terms of social distancing, case tracking, etc., mask use, it would have been over 6 million cases by that period in March. South Korea, early April, not quite 10,000 cases. Had no interventions been instituted, it would have been over 11 million cases at that point. Italy, same period in early April, 129,000 cumulative cases. Had nothing been done, over 2 million. France, end of March, 25,000 cumulative cases. Would have been 304,000 without interventions. Iran, 21,000. Would have been nearly 5 million cases otherwise. And in this country, at the beginning of April, 364,000 cases, would have been over 5 million cases without interventions. So we have done a really good job to some extent. Had we not had these tools in our armamentarium, this would have been an unbelievably much worse situation. The authors said, we estimate that across these 6 countries, just these 6 countries, interventions prevented or delayed on the order of 62 million confirmed cases, corresponding to averting roughly 530 million total infections. And in an accompanying article, the first author said, the last several months have been extraordinarily difficult, but through our individual sacrifices, people everywhere have each contributed to one of humanity's greatest collective achievements. I don't think any human endeavor has ever saved so many lives in such a short period of time. There have been huge personal costs to staying home and canceling events, but the data show that each day made a profound difference. By using science and cooperating, we changed the course of history. So we can be proud of what we've done. But it's clear there's been a great deal of hardship associated with this whole effort. After a couple of months, people were tired. We're getting mixed messages from some corners. They were hearing, we've got to continue to be careful. We've shut things down. We've got to continue to protect ourselves and our neighbors and our family. From other quarters hearing, no, we've got to open things up and rescue the economy and have fun again. One quarters, avoid large crowds. From other sides, large crowds are fine if you want to do that. And wear masks or don't wear masks. So it's been a really confusing set of messages that the public has received. This is Memorial Day, which was sort of a turning point in a sense, where people just went out and threw all cautions to the wind. We're paying for that now. Here are the cases in this country starting at the beginning of March with an uptick. And it was at this point that things became really critical because hospitals were overflowing, et cetera, and the policies were instituted. And then we really did do a good job of so-called flattening the curve. Things began to open up. And here we are now this was yesterday. You can see that the cases are climbing again. And in some states, I think there are 13 states with the darkest color, have had an over 100% increase. In other words, the new cases averaged over over the last 2 weeks have more than doubled in at least 13 of the states. So we've got a ways to go. It's still going to be a struggle, but anyway, at least so we can feel a mixture of feeling good about ourselves and also feeling some concern that we need to have a greater degree of control over the situation. Also comparing ourselves, the United States in the blue with its recent uptick to the European Union. As an example, the European Union has done a much better job of keeping the cases under control. So we've had the bad side of things, but then there's a really interesting experience that we're also going through. There was the tragedy with George Floyd in Minneapolis that prompted protests throughout the country, Black Lives Matter, et cetera, and throughout the world. This is a scene in London. And the thing that is so impressive to me is this one sign in the middle. Things will never be the same. Something has happened differently this time. This has taken hold. The Graduate School of Public Health faculty meeting a couple of days ago, yes, 2 days ago, almost entirely devoted to this issue of racial equality, of undoing and correcting situations that have been in place for a long time and need to be handled and dealt with appropriately. Excuse me for the wayward motion here. We have seen statues coming down, a few by protesters, and now mostly by the governments of localities and states deciding that the symbols of slavery, the symbols from the Civil War, this is John Calhoun, our 7th Vice President of the United States, who is an avid supporter of slavery, these symbols are being removed. Something is different now. Why is this happening in the context of this pandemic? All I can say is that it's some indication to me that something is in the atmosphere. There's a challenging and terrible side to it, but there's also something that may end up promoting progress. I want to close by turning back to my father, who started his work with infectious disease, worked both with influenza and with polio, and in the last part of his life turned his attention to a great extent towards the future of humanity. He wrote 4 books, the third of which was with my youngest brother, Jonathan, called World Population and Human Values, A New Reality. Jonathan has just republished that book with updates and revisions on a new title called A New Reality, Human Evolution for a Sustainable Future. Another of my father's books was The Survival of the Wisest, which was the subtitle of a symposium that was held in his honor at the centenary of his birth at the University of Pittsburgh. I just want to show you a little bit of the kind of thinking that he elaborated that I think is relevant to our understanding of the situation that we're going through today. Looking at world population growth through history, nearly flat, slow growth over millennia. You can see a little notch of the plague, its effect on the populations in Europe. And then in the last couple of hundred years, this enormous growth in population as a result of the Industrial Revolution, the Scientific Revolution, the Agricultural Revolution. Absolutely remarkable what has taken place. Looking at that, what's the prospect for the future? Here's where we were at the time that this graph was drawn back in the late 1970s, early 1980s. Could this population growth keep going forever? Answer is no, because we're living on a finite planet and we would end up being squished together like sardines in a can if that were to take place. Another possible scenario might be overusing the resources in our environment, having other calamities take place and having our population crash, not an ideal outcome. And a third might be following this S-shaped curve, where the population growth would stop its constant acceleration, pass a point of inflection, and then begin to plateau. So that kind of curve is one that is seen in nature. If you take a couple of fruit flies and put them in an enclosed environment and continue to feed them, the population will increase exponentially for a time, and then will reach a point of inflection and plateau. You see the same thing, you put normal cells in tissue culture, they'll grow exponentially, contact inhibition will give them the signal, slow down, and then that growth in culture will plateau. My father looked at that growth curve and said, basically, there are two different segments to it. This first segment, and thinking of the human population, he termed epoch A, which is characterized by constantly increasing growth. And after the point of inflection, moving into what he called epoch B, which is characterized by a slowing of the increase in growth until one reaches a plateau. He also reasoned that the values and attitudes and behaviors associated with what makes things tick in epoch A versus epoch B are different. In epoch A, and I know this from being a kid, when I was born and started to grow up, there were no limits. The sky was the limit in terms of what we could anticipate as a human being. We were consumed with the notion of consumption, taking advantage of what nature had to offer for us, the environment had to offer for us, not really caring so very much about what happens to our waste. Where in the second phase, epoch B, this is characterized by the imposition of limits. The world is not infinite. There have to be limits to our growth in various aspects of our life. Conservation becomes more important, and sustainability becomes a major issue. Here, we're looking at another aspect of life in epoch A, so to speak, characterized by competition. What's going to be necessary in epoch B is a greater emphasis on collaboration. Here, independence was a primary predominant feature. It's not that this will go away, but interdependence becomes much more important for us to successfully to make this transition. Here, decisions made by power, moving hopefully to a situation where decisions are being made more and more by consensus. So what my father projected was that around this point of inflection, there was going to be a lot of tension because we're having a clash, in a sense, of two different mindsets, two different sets of attitudes and values and behaviors. And I think this is indeed what we are seeing today. And one aspect of this is that there are going to be those who are used to epoch A, to constant growth, to providing as much for oneself and one's family, et cetera, as possible. And there's going to be a tendency among those to want to maintain things in the way that we have been used to. And then there's going to be another subset of the population with a vision to the future and a recognition of the need to change some of our basic fundamental attitudes and behaviors and so on, pulling things in this direction. So I think that's what we're looking at today. Even in the kinds of conflicting messages that people have received about how to handle the epidemic and so on, we're dealing with this kind of strain, this kind of tension. So I'm going to leave it at that. I just want to end with a tribute to my father. on Tuesday of this week. That day represented the 25th anniversary of his death. And this was a man who was extraordinary in terms of his vision, his humanity, the work that he did, the contributions that he made, not only in medicine, in public health, having founded the Salk Institute for Biological Studies, but in this deep caring and concern for humanity and its future, and the guidance and wisdom that he has provided to us. So I'll end on that note. I can stop sharing my screen, and I will turn things over to Melan.
Well, thank you, Dr. Salk. Nothing like following that talk, so I'll try to do my best. Well, by first remembering to share my screen. Okay, great. Well, thank you so much. It's my pleasure to be here to talk to you about, again, I was asked to give some perspectives about the response and the current outbreak and how we can move forward and what we can learn from this. So again, happy to do so to move forward. Can everyone hear me? I want to make sure. And have I turned my camera on?
Yes, you're perfect. You're good to go.
Okay, great. So with this next slide, so I want to start with a disclaimer, and this will be the fastest slide that I'll go with. And again, I want to be very clear that everything that I'm going to be sharing with you are just my conclusions and from me, and that is that not representation or not, of either CDC, Office of the Assistant Secretary for Health, U.S. Public Health Service, Department of Health and Human Services, or that of the U.S. government. So with that said, I am the Regional Health Administrator here in Region 6, and what we do here, as you can see across the country, there are 10 regions, and the Regional Health Administrators, the RHAs, they respond, promote, partner, inform, manage, and they do so by catalyzing public health action through their regional experts and networks. So again, just a few slides on some of the experiences that I've had working at CDC and now with the regional office here is how that has helped me move forward, and that is the continual learning process and being open to ideas and being open to diversity of experiences and encouraging openness. And having been lucky to have worked with cross-cutting disease-specific and domestic and international experiences, and thinking through about working with clear expectations, working with folks who have had unique goals, and the idea is that public health is a very unique science, and that is because it helps people. So, I mean, you have to love the field to be able to work in it effectively. Something that is going to be really paramount in how we move forward is that nothing can be done without working with others. And that was something that Dr. Salk obviously was talking about, and that is through the work with state and local health departments, tribal entities, academia, communities, foundations, that can go on, and so many others. And again, I've been so fortunate to have worked with so many wonderful, amazing mentors and supervisors. And these are just some core values that have been instrumental in the process of thinking through about how one can be successful in public health. And I've tried these. And again, thinking about integrity, respect, commitment, and follow-through, transparency and inclusiveness, because after all, and results-oriented, after all, our word is really our only currency, and that's what we need to make sure that we can deliver on. With that said, let me get into the major conversation here, and this is a representation of how interconnected we are with other parts of the world. And this is just showing to us that a health threat anywhere is a health threat everywhere. This is a depiction of showing of where we think through of emergence of and spread of new pathogens, starting from HIV, going to avian flu, thinking through about globalization of travel and thinking about food supply, rise of drug resistance TB, and also intentional release of certain engineered, an anthrax, for example, and of course, this first SARS epidemic, and then Ebola, and then of course, Zika. So I'd like to start the conversation with a relevant quote from a former U.S. Surgeon General. Many of you may remember him, and he was C. Everett Koop, 13th U.S. Surgeon General under President Reagan. He had done a lot, and this was one of his famous quotes, and I think that it resonates very well in our days now, and that healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. And with the understanding that, yes, we have pandemic, COVID pandemic right now, I think that we have to realize, and others have said this much more eloquently, that there really are three emergencies going on right now, and all of them have to be addressed. And first, of course, is the pandemic, and that's something that needs to be responded to. The other is this sort of emergency of fear, panic, the unknown. And that is something that's pervasive, and that needs to be addressed with compassion and needs to be addressed calmly, and it cannot be dismissed. If one does so, it can have wide-scale detrimental harm. And in the initial beginnings of the outbreak, there was some thoughts, some of that occurred against Asian Americans about the fact that this was as a result of them. So again, it was because of the fear of the unknown and not having that and then of course having the population face some of this fears against them. The third is something that is going to be with us, and it's not necessarily for this response. It's with us for the foreseeable future, and that's the never-ending 24/7 outlet of information. Whether we're talking about mainstream media, or whether we're even talking about peer-reviewed literature. I mean, so some of the differences between, say, the first SARS outbreak that was back in 2003 to now. There was no such thing at that point of what it is now of preprints. So now publications are coming out without necessarily being peer reviewed. So one of those things is that, so now one has to be ready to respond to those. So whether real or not, one always has to be able to address those. So we have to be able to address all three of these. And again, people who are necessarily opposed to our views or have differing views have to be addressed in a cordial, responsive manner, because otherwise you will get nowhere in terms of the response. So, and a former CDC director said something very eloquently as it related to the Ebola outbreak, and that was, we need to be first, we need to be right, and we need to be credible. So related to, and this talks about what Dr. Salk was talking about a bit, and that is, of course, with the current pandemic, we don't really have a vaccine. We don't really have effective treatments per se, but all that we really have in our arsenal are the plain public health measures that we've had for many years, and that's washing one's hands with soap and water, staying home when sick, covering coughs and sneezes, and social distancing. So just briefly talking about as a few things about the current outbreak, and that's the heartbreaking cases, and that is total cases as of June 24th over 2,336,000. and total deaths of over 121,000. And this slide shows the age-adjusted, and these results are as of June 6th. And these are the COVID-19 associated hospitalization rates. And one you notice that are highest among people who are Hispanic, American Indian, Alaska Native, non-Hispanic, American Indian, Alaska Native, non-Hispanic, Black, and Hispanic Latino. One of the things that I want to draw your attention to is that many of the results, many of the records here are missing related to the race ethnicity. And so one of the things that we're trying to do a much better job on is to ensure that those variables are collected so that we have much more accurate data. This is from as of June 13th, looking at COVIDNet, a weekly summary of the hospitalization data. And I've drawn arrows to the 3 top medical conditions: cardiovascular disease, hypertension, and obesity. The top, one of the 3 top medical conditions as it relates to the confirmed hospitalizations. One of the areas that I wanted to draw particular attention to related to the COVID outbreak response is a social determinant of health issue, and that is food insecurity. One thing here is to note is that this is a survey that was done in 2020, and one that talks about all households, and those households with children under 18 and children in households with mothers with children 12 and under. And as what you can see is that there is a rising level of food insecurity. And those black horizontal lines are those where the levels were when this same survey was last conducted in 2018, where you can see the magnitude of the rise in just 2 years. So this slide shows, this is from the Bureau of Labor Statistics, looking at a scattergram depicting the correlation between susceptibilities for COVID-19 infection due to occupation and annual income. So the blue dots represent non-medical occupations, while the green dots represent medical. The further down and to the right of the chart your occupation is, the lower you get paid and the higher likelihood of COVID-19 infection. For instance, the most extreme examples charted are CEOs, highest paid, safest, on the top left, and orderlies are the lowest paid, most dangerous, on the bottom right. All at-risk occupations, whether being non-medical or medical, must leave the house in order to work. The lower paying occupations are associated with less education degrees obtained. This slide is from Resolve to Save Lives, and very simply showing 3 cost-effective, feasible interventions that could be done to save almost 100 million lives around the world by 2040 by just eliminating these top 3 things: trans fats, controlling hypertension, and reducing salt. And if done all 3 together, nearly 94 million. And if I draw your attention to looking at most common COVID-19 comorbidities associated with it is hypertension, obesity, diabetes, COPD, and cardiovascular disease. Very much of an overlap. Another social determinant of health is that zip code is proving to be more informative than your genetics on your life expectancy. A person in the U.S. can expect to live an average of 78.8 years according to the most recent numbers from CDC. However, life expectancy varies widely across geography. So a child born in Mississippi today could expect to reach his or her 75th birthday, but a child born in California, Hawaii, or New York could expect to live into his or her early 80s. And as you can see depicted in this analysis that was done from 1980 to 2014, you can see the inequalities of life expectancies among the U.S. counties. This shows the differences in life expectancies between the lowest ranking counties and the highest ranking county. And the biggest difference is over 20 years. So one of the things that I'd like to do is to talk about the fact that the COVID-19 pandemic underscores that our health is inextricably linked to that of our neighbors, family members, co-workers, factory workers, first responders, delivery service people. Second, our current system does not adequately protect our well-being, and that we have seen that our community is feeling pain and is harmed in some form, some much worse than others, including people of color, workers with low incomes, older adults, those with pre-existing conditions, and especially those already living in places that were hard hit before the pandemic. I couldn't talk about COVID-19 and the response without talking about the effects on mental health. Of course, as we have seen, there have been huge changes to how we now live our lives. Social distancing, isolation, quarantine, unemployment, record unemployment, financial stresses, business closings, children at home, and of course not in school, coupled with parents working from home and all the stress that's associated with that. Social distancing, huge issue. Social distancing should not be taken to mean social isolation. There have been many people who have said that has caused a huge amounts of problem for people related to loneliness, and especially older adults. However, there have been some people who have been unique in terms of some exciting, innovative ways where they found a way to have social distancing while yet remaining socially and remaining not isolated. But related to the mental health issues, some of the things that we know that we've heard is that there's been over 1,000% increase in the use of the disaster distress helplines, for example, all states applying for crisis counseling program funds. Reported calls increases to suicide prevention lines, increases in calls related to domestic abuse, and I can go on and on. So again, this is a huge issue. So trying to wrap up here, in terms of thinking about the synergistic effects of social determinants of health and COVID-19 infection, and tying it all together, clearly there are risk populations, minorities, at-risk populations, vulnerable. Some of the predispositions for the populations that we're talking about, the pre-existing conditions. Again, prior to this pandemic, we have had an obesity epidemic, and we currently have an obesity epidemic. The high-risk occupations having to do with the lower education levels predisposes some of the people having to face the COVID and thus not being able to stay socially isolated, for example. The geography, the lack of access to healthcare, insurance status, the rural status, housing and food insecurity, and education, and so on. So what are some of the things that we can do as far as the road ahead? One of the things, obviously, clearly is move away from the sick care system and move into a more health promoting and one emphasizing primary prevention. And again, we have to start early. And again, starting from childhood. We know that childhood obesity is a powerful predictor of obesity in adulthood, so starting early is a way to go. Physical activity, youth sports strategies. There's a National Youth Sports Strategy Initiative that's come up. There are the national dietary guidelines that have now been coming up for the healthy people. Education, ensuring that kids growing up are up to their education status. So those are all important. And then, of course, I started with a quote from a Surgeon General, former Surgeon General, and I will end it with current U.S. Surgeon General, and that is, none of this can be done without having better health through better partnership. And one of his clear-cut initiatives are community health and economic prosperity, making sure that that cannot be done without ensuring that having prosperity through the economic communities, working with all across sectors to ensure that communities thrive. And of course, being in public health, one cannot stay without going through Maya Angelou's famous quote, and that is, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So with that, thank you, and I will stop sharing now and turn it back to Jesse.
So thank you both so much. I think we now have some time for questions. So there are a couple already posted in the Q&A, but please, for our audience, if you want to add to them. Mehran, I'm going to ask if you could turn your camera back on. It would be great to be able to see you as we respond to these. I wanted to first thank you for both highlighting the importance of sort of systems thinking and the interconnectedness of everything and how that impacts health and well-being. Also highlighting the importance of communication and community engagement. And finally, thinking about sort of primary prevention and what can be done. And I forgot, I made a note, also the life course perspective, right? So you really wrapped in everything about public health and all the various elements that we address. So I'm gonna start with a couple questions that are posted here. So one is, should the public health community have been more forceful in the messaging that gatherings of large groups were counterproductive during COVID? So more about the messaging that was coming out from public health. And maybe we can start with you, Dr. Masudi, and then go over to Dr. Salk. Sure.
I will try to provide as much as I can about what I can say. I think that this is a very touchy situation, obviously, because public health, from the federal side, we can recommend, and states, as we know, are autonomous, and governors are the best in terms of their abilities to be able to enact. And so we do our best in terms of recommendations. I think one thing that was extremely challenging with this virus was that there was we had to admit that there were very few things that we knew about this virus as we went through, and as was apparent with the use of the face coverings, for example. Initially, as you recall, we were saying that the public didn't need to necessarily wear face coverings. But then later the messaging was changed. Why? Because it wasn't that we were just for the heck of it changing messaging. No, it was seen that some folks before they could be, having COVID and asymptomatic, and beforehand, 2 days or so, they could be transmitting. So because of that, and for them to be going out, we wanted to ensure that they would wear that. So for some people, they may have seen that that's inconsistency, but that's the fact that we were being honest. And so in trying to learn as much as possible and being communicative, I think that was perhaps one of the challenging things about this, and trying to understand the best that we can about this particular virus, which is challenging. So I think that that was the best that we can do in terms of our ability. So I'll stop there and see if Dr. Salk has anything else to add.
Yeah, thanks, Mehran. It's a complicated issue. There's the advice from the public health community. Then there is the fact that people see things differently. They don't want to be, some people don't want to be told what to do. It's a sort of a freedom aspect to the whole thing. And if I wear a mask, I'm going to be being seen as compliant with something that I shouldn't have to be complying with. It's a hard situation how best to communicate. We're now all faced, I'm sure, with people on social media that don't see things the same way we do. And Mehran, I think you made a really important point. we need to be gentle in our communications and understanding of people, where they're coming from, and for each of us to do the best that we can from our own sides to communicate the truth as we see it without somehow undermining a person's sense of their own dignity.
Thank you both. So to follow up, I think there's a question here about how do we overcome the politics of public health with the real and present of danger of COVID-19? So how could we help political folks understand the reality of public health needs? I think that is a complicated question, but I will maybe start with you, Dr. Salk, and give Dr. Masudi a chance to comment after that.
Yeah, you know, I think that in a way, people are being forced by reality. Whatever advice was being given, just full steam ahead, open everything up, get back on track, the virus is going away by itself. Reality is speaking, and we see what's happened. And in states that have just gone forging full speed ahead, they're having to shift course. It's being forced on us because we're dealing with the reality, and we have no choice other than to comply with the needs of what we have to do.
And I think that from the side of science and public health, I think that we just have to be honest and convey the message the best that we can, and recognize that there are people who may be differing with our views. And I think that you know, there are many issues in public health that there are varying opinions, and that's the way society is. And I think that the greater times are we can come together, and the more, I think that we don't succeed by trying to downplay or minimize the importance of where other people stand by saying that we are better than them. I think that the more we try to elevate to say that ours are based on science and evidence, and let people understand what are the consequences of what happens, and then if they then see it, let them recognize that, and then and don't do a "well, I told you so," or do anything like that. But I think that eventually people will come across. But that's the best way, I think, to move forward.
Great, thank you. So a question here. First, a comment. Thank you for excellent presentations. What messaging could occur about a second wave and the possibility of the virus mutating? Maybe we'll start with you, Dr. Salk.
Dr. Fauci has said we're not through the first wave, and we're seeing the consequences of not taking that fully seriously. I don't know what to say about messaging other than that people, we don't understand this virus fully yet. We really don't know what's going to happen. Seasonality does not seem to make a huge difference up to this point. Will it get worse in the fall? What's going to happen when influenza comes along at the same time? What Mayron said is, I think, very appropriate. We just have to be as clear-cut as we can in terms of expressing what is known and recognizing that there are still things that are not known. There may have been another aspect to that question, but I don't remember.
It's about the possibility of the virus mutating.
It's bad enough as it is. I don't have a firm grasp on the reality there, so I don't think that that's something that really makes a whole lot of sense to be putting attention to. We've got a reality to deal with in front of us, and so let's just do the best we can with that, with what we have.
Wonderful, thank you. Dr. Masudi?
Yeah, I think that the first part is absolutely that we're not through with the first wave. And I think that we are now seeing many of the governors reacting to the results of the additional, of the higher cases, and so they're being responsive. So I think that that's happening in many of the states. So, but related to the mutating of the virus, I think that that's something the experts are well aware of that happening, and I think that there is very clear communication and collaboration that's going on from not just us in this country, but other collaborators across the world, and are seeing that happening, that we can make sure to keep an eye on what's happening to see if there's any changes that's occurring to the virus itself. But again, I agree with Dr. Salk that this virus as is has enough challenges associated with it that if we can work with this right now, that's enough. And let working, with the variants to some of the lab experts to tell us.
So a question about that it was a great point that you made about social distancing not meaning social isolation. However, current messages have the elderly so afraid that they're choosing isolation. What can be done from a communication point of view to address this key point? Maybe Dr. Masudi, since you brought that up.
Sure. So I think that that's a huge issue. I think that it's not something that, I think, again, as I said, it's an innovative way that folks have thought about using technology through phones, computers, with FaceTime or Zoom, or, even with our in-laws, having, meetings, setting set times, having them come out. Again, social isolation, social distancing, you can have meetings outside of, having people come out to the door, to the window, and having conversations, writing cards, and expressing those. I think that those are remaining very close to some of those people. And I think that what really brings a message home to those ideas is that we shouldn't, again, starting early is always the process is, we're thinking about it now about older population, but think about it right now. I mean, some of us are going, haywire right now at being at home and looking at each other, saying, is this over yet? We're just going to the office, and sometimes many of us can't go to the office, or so we're at home teleworking and doing this, and thinking how difficult it is, and how we can't go see our friends, or we can't do that, and that loneliness that comes with that. Now, package that and imagine how that feels when you're older and alone. And so now you have a better perspective of what it feels like when you're older. So perhaps now we have a population that is more aware of some of those issues. So I'm hoping that some of that feeling, so again, being in one's shoe always makes one feel a bit more understanding of those challenges. So I'm hoping that some of those may get some people involved in those. But again, making routine visits, again, just because you can't be close to within the 6 feet apart, but it can be, one can visit outside the doors, nursing homes, for example, many of them have gone outside. They've had, block parties for people who have had birthday parties, for example, who have driven by, so those are all creative ways. In our neighborhood, for example, there was a World War II vet, 95 years old, his birthday. We drove by his, to wish him happy birthday. So he was sitting outside in his, outside. So we didn't get close to him, but again, that was a way to pay tribute to many of those people. So I hope that was enough clarification.
That's wonderful, thank you. And highlights the importance of being creative, right? So the watchwords I feel for much of what we're doing right now is how can we be creative and flexible, sort of given what we know and the parameters of where we are, and to try and make it work. Sadly, we are out of time. I want to give Peter a chance if you wanted to say any concluding remarks or to follow up on that, and then unfortunately, I need to wrap us up.
Okay, I just want to say two things. One is thinking about the future of public health, what we've seen from this racial business that has come up. we need to be considering all of the different facets of our environment that impinge upon us, whether it's poverty, whether it's war, climate change. All of these things and racism need to be seen in the context of public health. They have an impact on all of us as individuals and as all of us collectively. And second, that we may be able to use some of our inner resources as human beings to create greater resiliency, and the programs that involve that could help in terms of some of these larger scale public health issues.
Wonderful. So thank you both so much. I want to thank everybody who's participated today. I know there are some questions we didn't get to, but I'll see if our speakers will write up some responses and we can post them on our website. And to everybody who's participated in the series to date. Before I wrap up, I do want to take a minute to thank all the individuals who helped to make this all happen. And that includes a really special thank you to Mike Singer and Joe Armada from the IT department, and Jill Rumpler for our events and external affairs coordinator. They have made this all run really smoothly, and I really appreciate all that they do. So as a reminder, the recordings from the seminar and other information about our COVID-19 related efforts are available on our school's website. And you'll find information about COVID-19 efforts and the programs that we offer. So there's much work to be done. And we look forward to partnering with all of you moving forward. So thank you all so much, and have a wonderful evening. Thank you.
Thank you.
Thanks, Jesse.
Thank you both so much. I'm sorry we ran out of time. It's always so hard.